Hello, everybody. I'm back. Dr. K.K. Agarwal, President, Confederation of Medical Association of Asia and Oceania, past National President, Indian Medical Association, and President, Heart Care Foundation of India. And you are watching Medtalks with Dr. K.K. COVID edition. This is going to be 1622nd COVID episode with 203rd Medtalks with Dr. K.K. Let's have the headlines of the day. Indian drug regulator DCGI did not approve, the experts committee did not approve the Pfizer vaccine in India, that the evidence in Indian trial is still not sufficient. And based on that, Pfizer has withdrawn an application of emergency use authorization of its COVID-19 vaccine for now. So for now, Pfizer vaccine is not going to be available in India in near future. The latest Sero survey reported that 1 in 4 children aged 10 to 17 may have COVID-19. The ICMR survey is disappointing because 75% of the population in India still does not have the antibodies. The healthcare workers would be administered the second dose of COVID vaccine from February 13th. I will be receiving my vaccine on February 20th. Active COVID-19 cases in last 24 hours fall below total deaths in India. Johnson & Johnson requests emergency use authorization for COVID vaccine. Let's have the topic of the day. COVID updates from Southeast Asia, and I have a special guest, but before I invite my special guest and introduce. We have a customary in India of Atithi Devo Bhava. We wash our hands. Suman K. S for Seedha, U for Ulta, M for Mutti, A for Angutha, N for Nakhun, or K for Kalai. Once we have done that, we are ready to invite our special guest, Dr. Ravi Naidu, immediate past president of Confederation of Medical Association of Asia and Oceania, my senior colleague at SIMA, graduated from University of Mysore in India on a deputation from Malaysia and awarded the degree in 1980. From 80 till 2007, he achieved various other qualifications, among them being Fellow of Academy of General Education, Licentiate of the Faculty of Occupational Medicine, Membership of the Faculty of Occupational Medicine, and Fellowship of the Faculty of Occupational Medicine. He was awarded Honorary Fellowship of IMA CGP. He obtained his postgraduate Diploma of Medicine in Sports Medicine. He received the AMA Guides to Evaluation of Permanent Impairment from American College of Disabled Medicine. Honorary Fellow of IMA AMS, served as a past President of Malaysian Medical Association and past Vice President of Commonwealth Medical Association and Charter President Rotary Club of Batu Gajah, Malaysia. So welcome, Ravi, to be here in our show.
Thank you very much. Okay, it is my pleasure to be here. Good evening to you.
Good evening to you and all my viewers who are watching this program. So let's come back. What is the current situation in Malaysia? Have we started the vaccination there?
Okay, the vaccination, Malaysia has chosen the Pfizer vaccine. And our first consignment will be arriving on the 26th of February. And the government has agreed or has confirmed that 1 million doses will be brought in, and this will be made available for 500 million people. And they have agreed that the first batch of people to get will be the healthcare workers, followed by the frontliners, which are like the police and the armed forces and the allied health professionals. And then it goes on to the senior citizens and then to the rest of the population. They expect to complete this by early 2022.
So that means, okay, yes. So one full year we can talk about.
Yes, almost a year, that's right.
And how are they going to manage the storage of minus 70 degree in your country?
Well, they have actually purchased 6,000 refrigerators so that they can store this vaccine at minus 70 degrees, so that these 6,000 refrigerators can be circulated to the various parts of the country.
So this has been purchased by the government.
Yes, everything is by the government.
And what are they going to do to this minus 70 degree temperature after the vaccination?
Well, I think what they think is this is not going to be just a one-off thing. It's going to be for some time to come. So as you're fully aware that Pfizer vaccine you have to give in 2 doses. Of course, the duration on how long these vaccines will last is still not very definitive. So probably they need the refrigerators after that too.
And what about Oxford vaccine? Is the government also negotiating with them?
Yes, they are also negotiating with AstraZeneca for a batch of vaccines to come in.
And what about the Chinese vaccine, Sinopharm?
So far, we have got only a trial being done with that, but so far, no other indications.
And what is the current situation of COVID in Malaysia?
Well, the situation is quite bad at the moment. We are now in a total lockdown. They call that the movement control order in Malaysia now, except that they allow all businesses to function. They do not allow you to dine in. You can take away the food. The number of people in a mall are limited. They have to follow strict SOP in terms of wearing face mask, regular hand sanitization, and to make sure you maintain the social distancing.
And what about the graph is this is a second peak occurring or the third peak occurring?
This is the third wave now. The third wave now, like for example, now the total number of cases in Malaysia since the beginning of the pandemic is 234,874 cases, out of which about 185,000 have recovered. And the total deaths so far as of today is 845. And compared to the first wave of the COVID, the third wave seems to be very severe with more number of cases.
So do we have a particular strain in Malaysia? Is it the UK strain? Is it the
No mention of that actually at the moment.
Because we if you recall that we very clearly have discussed this in Simao meetings,
Yes,
that any new wave which is bigger than the last wave has to be a mutated strain. It cannot happen without a mutation. So maybe in Malaysia you are having either a UK strain. So there is no genomic center in Malaysia.
I'm sorry, I'm not aware of that part of it.
No, do they do gene analysis to find out which mutation it is?
Yes, they are doing.
So as on today, they have not disclosed what type of a virus
I
it is.
think they have disclosed one mutation, but I'm not very sure about that.
Okay, is there any serosurveillance in Malaysia? That's, for example, in India, Delhi showed 50% of the people are seropositive. And in India, we got a circular yesterday from ICMR study, which shows 25% of the people in the whole country. That means over more than 30 crore people have already suffered from COVID-19 infection, which is 10 times your population in Malaysia.
Yes.
So do you feel that there is any sero survey of Malaysia?
I think so far, I'm not aware of any such thing.
Number of deaths amongst doctors in Malaysia?
The number of deaths are not many actually among the frontliners. Not many.
So what is the standard protocol as on today? What is being formed? This is being treated like every patient is treated by the government, or the private sector is also involved?
Well, at the moment, what has happened is because the number of cases have increased tremendously, the government sector or the public sector is blowing at its seams, is breaking up. They can't cope up. So what the government has done is they've negotiated with the private hospitals to also be involved in the treatment of these COVID cases.
Any specific thing in severity, what type of patients who are dying, or if we see 845 deaths, do we have any data to say which patients have become serious?
Yeah,
And
these are those with the chronic NCDs and also those above 60 years old, the majority.
so, what protocol are we following? The WHO protocol, or Malaysia has their own protocol in
They
saving them?
follow the WHO protocol.
See, what I have seen in my own practice and what we advocate from Confederation of Medical Association of Asia and Oceania also. So we follow, number one is that death cannot occur without a inflammation or a thrombosis. Okay, so we treat them early. WHO still says give steroid when you have evidence of clinical hypoxia. We go beyond that and we say treat the patient when there is an evidence of cytokine wave, that means CRP more than 10. Don't wait for hypoxia to develop. And in such a cases, now we are seeing less and less of mortality. Because even today, if you give, if you're going to be aggressive after the complications have developed, it may be too late. Anything you want to share for that?
Well, here what has happened now is they have divided into 4 stages: stage 1, stage 2, stage 3, and stage 4. Stage 1 and 2 will be mild, which means there's no involvement of the respiratory system. They have said that at stage 1 and 2, they can be quarantined at home and ask them to remain at home. Unless they have some complications of the respiratory system, then at stage 3, they go to the hospital because they can't cope with the numbers in hospitals now.
Okay. So anything else in Malaysia that we come back to adjacent countries? What about adjacent countries from Malaysia? What are the
Okay.
restrictions going on?
The other countries is, of course, the next, our neighboring country is Singapore, is doing actually extremely well. I think they are only recording about 30 cases a day, and their vaccination program has already begun, and they are using the Pfizer vaccine. And Thailand, well, the case was they were almost zero until the 17th of November when the second wave began. And they have about 400 plus cases, but they attribute it to the migrant workers in Thailand. As for vaccines, what they're doing is it is being locally manufactured by some Thai companies, and they expect the rollout by June 2021. And that will be only for the Thai people. Indonesia has got a very big number, is about 12,000 per day. In their case, the vaccination has also started, and I think they're using the Pfizer vaccine too. As for Philippines, it's also a very big number. They have about 1,700 cases daily. And vaccine, they have sourced from Pfizer and AstraZeneca, which will probably be available by March 2021. And as for Brunei, actually they're doing very well. They're having 0 cases at the moment. And Vietnam is also doing very well. They only have about 7 cases a day, though their population is about 96 million people. And they are doing trials on their own for the vaccine.
So are you doing any trial in Malaysia? What a vaccine apart from the China?
Well, there are some patients who have been, about 3,000 of them have been used for the trial, but not Malaysia, but I think it's the China vaccine.
Okay, so when you were approving, say, Pfizer, what are the laws in Malaysia? Say in India, they disapproved Pfizer on the grounds that Pfizer has not done a study on Indian population. So
Well, yeah, sorry.
are you doing any study? Have you a study of Pfizer or being done has been done in Malaysia or not, or you just approved the vaccine?
Okay, we have what you call the NPRA. It's a National Pharmaceutical Regulatory Agency. They are the ones who do all the, they give all the approvals for any drugs that are brought into Malaysia. And they only give the approval if this vaccine has been found to be safe for the people of this country. So they are the ones who are the regulators, and they're very strict about this.
So no, do you think that Pfizer vaccine was used in Malaysia under a trial before they gave an approval, or they are
There
giving
was
an
no,
approval?
there was no information about it at all.
No, why I'm asking this question is that most of the countries are buying, most of the countries, a company like Pfizer or Moderna, if they have to do a trial in every country before they approve it, because once you know, I mean, only trying to find out it, why did India did not approve Pfizer? That's what I'm trying to understand. What might have been the reason for that?
Well, in Malaysia, so far, we do not know if there was any trial done with the Pfizer vaccines. But we are quite confident that the NPRA has been, they are a very strict regulatory agency. And they must have gone through the trials that have been done in other countries before they gave the approval for it to be used in Malaysia.
So let me come back from vaccine to why did you come to India? What was the agreement between Malaysia and India way back in 80s?
Actually, I joined the medical faculty in Kasturba Medical College in Manipal in 1970s. And why? Well, at that time, what happened is we only had one medical university in Malaysia, only one medical faculty. So there were not enough places in Malaysia. And India being our, well, I'm of Indian origin. My grandparents are from India. And having been of Indian origin, there was an opportunity for us, many of our Malaysians, to go to India and study medicine. And that is how I think you will find that many of them from Malaysia studied in India. Many thousands of them, I would say.
And now, what is the medical facilities there? How many medical colleges?
Oh, now we have about 30 medical colleges here. Now we are flooded with colleges, and the number of graduates coming out are huge numbers. We have something like between 3,000 to 5,000 coming out every year. And unfortunately, the government is not able to place them for their initial training, but they are trying their best. And sometimes once they finish their examinations and come back, they have to wait between 8 months to 1 year before they can get a posting as a house officer.
Okay, when you said that this Pfizer vaccine will be given to Malaysians, what is the population of non-Malaysians in Malaysia?
I would think at least 3 to 4 million.
That means almost like 10%.
Yes.
So how are
10%.
they? They are all citizens of Malaysia, or they are?
No. They are non-citizens of Malaysia.
Then who are they? They are, when you call them as
All of
migrant
them,
population.
many of them are migrant workers. Migrant workers, we have about 2.2 million migrant workers. Then, of course, we have these expatriate workers. Many of them are expatriates working in this country. Then we have spouses of many of our Malaysians who are foreigners. And then, well, this is only the registered people I'm talking about. We have got probably another 1 to 2 million of unregistered migrant workers in this country. When I say unregistered, that means they are illegal in this country.
And at this moment, there is no plan of giving them the vaccine.
So far, no mention has been made for the foreigners in this country.
And do we have an infection rate which is different, like we saw in Singapore, that most of the cases were in the migrant population?
Yes, we had. In fact, this third wave would have probably started from there. We had a factory which had a few thousand migrant workers, and many of them were infected, and that's how things started, and it's spreading now in the community.
And what happened in the second wave, and the political rallies caused the second wave?
The second wave, of course, was because of the election in one of our states called Sabah. And what happened is during that the state election, many of our people from West Malaysia, that is in East Malaysia, which has to be, they have to cross the sea. And they went there, and many of it sort of blew out of proportion during that time.
Okay, so I will now share with you some of our experiences, which can be helpful to other countries.
Yes.
So what we are doing is that, and specifically, I am basically over my 1,622 interactions with various people. What I am finding is that this virus is inflammatory virus. So I will call them as an inflammatory virus, and this vaccine is also an inflammatory vaccine. And the inflammatory, it is an immuno-inflammatory, because that inflammation is immune mediated. And because of this inflammation, it is causing thrombogenicity. So therefore, there are three components in it: immune, inflammation, and thrombosis. We are seeing people dying are elderly, high-risk people, hypertension, obesity, everything, one thing is common. And that is low-grade inflammation inside the body. So if you see frail, elderly, diabetic, hypertension, coronary artery disease, fatty liver, the only thing which is common is low-grade underlying inflammation. So as a cardiologist, we know that low-grade inflammation is defined as a C-reactive protein of 0.65 to 1. And a moderate grade inflammation is CRP between 1 and 3. And a high grade inflammation would mean a CRP of 3 to 10. From 0 to 10 CRP is a silent inflammation. More than 10 CRP is an overt inflammation. So what we are now saying is that this virus normally should cause mild inflammation and go away. But if you already have a mild inflammation, it will cause moderate inflammation. And if you already have a moderate inflammation, it will cause severe inflammation. Silent. It will make them overt inflammation. And that is causing cytokine crisis, which is overt inflammation. So now what we have analyzed is that all those people, so if your CRP is more than 1 on day 0, before you get the infection, you are unlikely to get a complication. Unless you cannot tolerate even the sympathetic response. So the death can be either because of over-sympathetic response, that means you can't tolerate tachycardia, adrenaline releases, or it can be an over-inflammatory and a thrombotic response. So therefore, if you know your CRP on day 0, and if you manage that CRP, and then we are finding two types of inflammation. We call them as IL-6 TNF inflammation and IL-1 beta inflammation, or interferon inflammation, gamma interferon, which causes low-grade fever, less than 100, evening rise, 2 hours, goes away. Or you are actually getting a cytokine fever, which is IL-1 beta, which will only be all right by giving either colchicine or mefenamic acid. So what we are seeing is in those cases whose CRP is more than 1 on day 0, if we put them on preventive colchicine, which is now we use in every patient of coronary artery disease, then we are preventing them going into becoming symptomatic pneumonia. That's what I am following with that. You want to share some of your experiences?
Well, I've got no idea about this because I've not treated in there, because all COVID cases are only treated in the public hospitals at the moment.
So there are a couple of questions. We have 5 minutes. Let me take a couple of questions from the audience. Vandana ji is asking, do you think it is advisable for Indians living in US to take the Pfizer vaccine? The answer is yes. Obviously, if it's available to you, why not? Why not? I personally feel is Ravi, because
Yes.
all those doctors who are living in US, I mean, there will be a good number of doctors in US
Yes.
who are Indians who have got a Pfizer vaccine. Is that not a trial?
Yes.
That's a trial available. Then why
Yes.
do you need a trial in India? If you can only take a data of all the Indian doctors who are in US who have got a vaccine there, I am a little bit surprised. Why do we need a bridging? Anuradha Datta, Arupadha Datta ji is saying post-vaccination CRP 1.87, pre-vaccination 0.89. On 4th, had started ACS on 3rd. For how long should I continue? When should I repeat CRP? I'm 56. So Dattaji, you can stop your aspirin. You say your CRP is 1.87, which is 30% increase, which is fine. Post-vaccination, we expect CRP to rise by 30%. And now you are all right. You can stop all the treatment and restart before the second dose, unless you need a colchicine because of your baseline CRP. So get your get your CRP till it becomes. I would continue your medicine till your CRP comes back to less than 1. So these are the people who join us live and continue discussing with us with that. So finally, I want you to give 5 messages for the public.
Number one, wear a face mask. Number 2, maintain the social distance. Number 3, make sure you wash your hands as often as possible. Number 4, my proposal is when you come back home after going out of the house, change your clothes, have a shower, and make sure you wash those clothes. And number 5, all I can say is keep fit while you keep safe.
So you keep fit, make sure that your nutrition is all right, your sleep is all right, your hygiene is all right, and you exercise every day. That's all for today. Let me thank Ravi to be here with us for this particular interaction. And we'll be back tomorrow, 7 p.m. with another show. Keep watching Medtalks with Dr. KK. Namaskar.
Thank you. Namaskar.